Hello, everyone. Welcome to the Preemie Health Talks. I'm Fabiana Bacchini, Executive Director of the Canadian Premature Babies Foundation and your host for this event. The Preemie Health Talks is the first of two international live series that CPBF is hosting 2020 in recognition of World Prematurity Day. In November, I'll be hosting Preemie Power Week, and all the information for that week is already available on our website. These educational sessions are in collaboration with the International Family Integrated Care Committee, the Canadian Association of Neonatal Nurses, EFCNI, and GLANS, the Global Alliance for the Newborn Care. For those not familiar with CPBF, we are a charitable organization, and our mission is to support and educate Canadian families of premature babies every step of the way. We believe that through consistent information, access to helpful resources, and peer support inside and outside the NICU, we can empower families, ensuring they are ready to care for their baby. Consistent information is especially important today when we are facing a global pandemic. With the Preemie Health Talks and the Preemie Power Week, we intend to bring you the guidance of healthcare professionals and the knowledge gathered by researchers around the world, which are extremely valuable to help us care for families and their babies. I want to thank AbbVie for the unrestricted educational grant, Pampers, and our team who worked really hard to make this week possible. And today I already had two sessions, one with Dr. Doug Campbell from St. Michael's Hospital, talk about the pandemic pregnancy guide. I talked to Anna Turpich, who is a bedside nurse, who talked about the fears and risks of working during the pandemic from the bedside nurse point of view in the NICU. And now I have here with me a very important topic. We have the parent. And right now we're going to talk about the parent experience in the NICU pre-pandemic, the journey of support at 24-week micro-preemie, being discharged at the beginning of the Canadian lockdown due to COVID-19. We'll talk about the impacts of the pandemic has had on bringing a baby home from the hospital, things to consider, and how it's been for her for the past 6 months. Aruna Boodram is the autonomous parent of Surya Amaris, a lively, thriving, and resilient 6 months adjusted baby. Surya is a micro-preemie who spent exactly 90 days in a level 3 and level 2 NICU. She was discharged at the beginning of the COVID-19 pandemic in March. Aruna is currently on parental leave from her position as a community legal worker at the South Asian Legal Clinic of Ontario. Aruna, thank you so much for joining us here today. It's such a pleasure to have the parent voice during this Preemie Health Talks.
Thank you for having me. I appreciate it.
So Aruna, tell us what happened. How did you end up in the NICU?
I was pregnant through an IVF pregnancy. So I did IVF in downtown Toronto with a unknown donor sperm from a sperm bank from the States. And I got pregnant, everything seemed fine. And then at my 19-week ultrasound, it was found that my cervix actually was very small and was actually opening. It was, they called it incompetent cervix, but I don't like that language around, bodies. So they called it incompetent cervix. And so my cervix was small and it was opening. And so I was immediately rushed to Sunnybrook, where I was seen by the doctors there. And then I think it was the next day, actually, I ended up going through with the surgery, with the procedure, around getting cerclage put in, so an emergency cerclage. And so that was at 19 weeks and I think 2 days. And then I was on bed rest at my home from week 19 until week 22. 22 and a half. I was on strict bed rest at home, going in only once a week for ultrasounds at Sunnybrook. And then at week 22, they saw that my cervix was opening again a little bit. And so they admitted me to the hospital to be watched in the not the birthing unit, but the high risk obstetrics, and I stayed on bed rest there until 24 weeks. So Surya was born 24 weeks and 4 days at Sunnybrook, and that was after 5 weeks of really trying to keep her in as long as possible. But we did it. We got her to 24 weeks. My goal was 28 weeks because a lot of doctors were saying that that would be when she's, you know, at her fullest potential development. But especially because I was admitted at 22 weeks, it was very scary. So we really didn't know what was going to happen. But yeah, she was born at 24 and 4, and took some breaths on her like when she was born, which is a really big deal, and then was almost and then put on CPAP, and then the journey began of the NICU. So yeah, that's how I ended up. You know, I didn't know anything about Sunnybrook. I didn't know anything about NICU life. I didn't know that this was even a possibility. I didn't even know about preterm labor. I had no idea about this whole world of prematurity and what I was in for. So yeah, it's been a roller coaster, which I'm sure a lot of parents will tell you is kind of the best descriptor of the NICU experience, is that it is so many ups and downs. It's a constant circus and roller coaster in some of the best and the worst ways.
Absolutely. So. And it's true, it's a brand new world that you don't know exists until you're in it. But
yeah.
before I have a lot of questions for you, but before we go on, I wanted to, because we use this as an education session for healthcare professionals and parents, we're always learning. And I had asked if you're a single parent, and you said, I'm an autonomous parent. Teach us, what is an autonomous parent?
So a lot of folks understand the term single parent. So I decided to have Surya on my own from the very beginning. So I was never planning to co-parent with anyone or to have a partner in my process of becoming a parent. And that's always been a decision that's been very important to me. And so if we think about the word autonomy as having autonomy over, you know, the way that we parent and the way that we are in our parenting journey, being an autonomous parent for me means that I am I'm autonomous in the ways that I parent Surya. I am currently partnered. I have a partner who has their own children, and they are very supportive. I have a very supportive partner in my parenting journey, but I am Surya's autonomous parent. So instead of saying single, because I'm not single, I say autonomous. So it actually is more reflective of the fact that she's being taken care of and being raised by many people, but I am the parent in this situation. So
that's great. Thank you so much for teaching us that. You're always learning, and very important to always be learning. So how did you cope on the first few weeks in the NICU?
Oh, wow. Coping was hard. Coping was hard in the first few weeks. I think as the roller coaster started, it was definitely a very mixed bag of emotions that I went through. I remember when the first day, so I gave birth to her on at 2:30 in the morning, 2:50 a.m. on the 21st of December. And so it was at night. And then I think I ended up going to sleep at 6 a.m., slept until 9. And she was actually a breech birth, but because she was so small, she just kind of literally it was no problem. It was not like nothing. And we didn't have to do the C-section, which a lot of folks do have to do at that early stage. So I didn't have to do a classical C-section. She actually just literally like ran out of me. And so because of that, I was actually able to go down to the NICU, and a lot of parents are not able to when they have the C-section or other more traumatic physical births. And so that was really lucky. I'm going to put that in quotes, lucky on my part, that I was actually physically able to go downstairs and go to the NICU right away. So by 9 a.m. the day she was born, I was downstairs. We walked into her having to be put on from a CPAP machine to be intubated. I literally walked in when the doctors were surrounding her incubator, and it was absolutely terrifying. so luckily my sister was with me, and we walked into this, what is happening. There was, I think, 8 or 9 people around her incubator or her isolette. Nobody could tell me what was going on. And then the doctor, luckily, one of the doctors who was, I think, a fellow, she took me aside and she's like, "Hi, I'm the doctor." And this is, I think, something for healthcare professionals, in this moment is a very teachable moment. This was very important for me as a parent, for someone to see me and be like, the parent is here and has no idea what's happening and is absolutely terrified. And she actually luckily took me and my sister aside. She sat us down on the bench and she's like, "This is what's happening. Everything's okay." But she's not breathing on her own on CPAP anymore. So that was my first, literally walking into the NICU that was my experience. And so I think I'm really grateful for that, because I think when she was born, because she was breathing a little and everyone was very surprised at the fact that she was doing okay, I thought that everything was going to be fine. And that was a really good segue into the start of a very, very tumultuous journey. The first few weeks were extremely the worst, I would say, because everything was so up in the air. We just did not know. The uncertainty of NICU parent life is, I think, the worst part about it. You can never get an actual answer from anyone. When they're like, "Oh, this happened. Is this okay?" We don't know. We have no idea. We can't actually give you an answer. And I totally get why doctors say that, but it is also very terrifying for a parent to be like, "You actually can't tell me anything about what this is this going to be the same tomorrow or not?" And, I know the mantra for a lot of NICU parents and staff and everyone is like, you just take it minute by minute, day by day. And that's really hard when, you want to expect or hope for your child to be okay for the next day. And so that, coupled with the fact that I was then feeling all the hormonal things that were happening post-birth, on top of, and it was right at Christmas, right? She was born on the December 21st, and then the 25th was Christmas. And, my mom is amazing and brought this whole turkey dinner situation, Christmas dinner, to the NICU in the family room, to try to give me some kind of excitement, happiness. And I literally just cried over my dinner the entire time. I was devastated, right? I think there's a lot of grief that comes through that. And some people, I know, some other folks in the NICU were like, "I'm fine, I don't feel anything." I think people cope in very different ways. And I definitely had moments like that. And then I also definitely had moments where I was completely breaking down because I didn't know what was coming next. And I think that the first few weeks, especially because she's so precarious at 24 weeks, the first 3 days, they have a I don't know if they do this at other NICUs, but in Sunnybrook, in the first 72 hours, they have a countdown timer for 72 hours. And once she hits that, she's kind of in a safer zone. And I remember for those first 3 nights, because I slept at the NICU every night at Sunnybrook. I didn't leave. I left for 3 days because I got a little sick, but I was there every single night. And it was absolutely terrifying watching that clock, right? So yeah, I think to answer your question, it's a hard one because it was all over the place. It was absolutely terrifying in a lot of ways.
So which strategies helped you to get through those days?
I know it's really hard now because of COVID and because of the corona, but I think this also might speak to why it is really important to figure out maybe different ways for people to get support. But for me, it was having support, having people to visit me or to bring me food or to check in with me. That was really important. Also, having access to the doctors and the medical team was crucial. And so at Sunnybrook, there were rounds every morning and every night. And I was there for every round, every morning, every night. And by the end of my time there, I was giving the team the update. So I was the one that was doing not the nurses. They were like, "She can tell you." I was giving stats, I was giving numbers, I was giving her her O2 number, everything. I was doing it myself. And that, I think for me, having that kind of not control, but kind of something around that I was actually doing something to support her was what was really useful for me, was to say you know what, I can't help this, I can't fix this for you, but I can at least be here and really, really try to support this process for you as much as possible. And so I do think that having that was really useful. I think having a team of medical professionals that talked to me about what was happening and didn't water down what was going on. They were very real with me every step of the way. And I for myself, I do advocacy work as my profession, and I've been a community organizer since I was a teenager. And so for me, I know how to advocate for myself, and I know a lot of parents don't, right? So, and I think that kind of gets, when you have a parent that doesn't really advocate as much, I think I've seen in different, from different families that it's harder to get that information when you're not asking for it or you don't know that's available. And so I think a lot of the time, medical professionals kind of like work with the parents as they are. Right. And then offering what is possible would be useful, like was really useful for me. So
absolutely.
Yeah, the transparency for medical professionals, I think, is really important. Yeah. In the moment.
But by participating in rounds, I find that is such an important thing, because you know, first you can be there as an spectator, but as you evolve in NICU and become more comfortable presenting around, I think it's such a wonderful skill that we can take for life, because a lot of our babies were born so early. We have so many appointments after discharge.
Exactly. Yeah.
So my next question to you is, when you're in the NICU, the hospital was preparing for the pandemic. How was that change for you?
Well, it was interesting because I was just telling you before, like I was at Sunnybrook when they brought the first patient in, like in all of Canada. The first guy who had COVID was at Sunnybrook while I was in the NICU. And it was absolutely terrifying. None of us knew what was happening. And I think we didn't know the extent of it at that point, right? We did not know that it would lead to we're going into almost a year now of like, we're heading into a very long journey into this pandemic. And at the time, I don't think any of us knew that this was what it was going to happen. And so when I was in the NICU, it was interesting to hear about this, but Sunnybrook did a really good job of containing it. And also for me, it was also about trusting the staff, that they also don't want to put themselves in danger, but also asking good questions, right? So for me, it was really important to ask questions about like, what are people doing about this? How are we protecting the babies? How are we protecting ourselves? How are things going to change? And everything changed so quickly that I don't think they had answers for that at the time. But it was really, when I was at the second level 2, so I was transferred to Humber River when she was, I think, 32 or 33 weeks. And the lockdown was very slowly starting when I was there, and things were shifting very quickly. So in terms of visitors not being allowed and things like that.
So how was that preparation from Humber River going home? Because now you're taking this fragile baby who spent so many weeks in the NICU home in the middle of a lockdown. How were you prepared to take the baby home?
To be honest, I feel like, and I've heard this a lot in like the Facebook groups and other micro preemie like parent groups. I feel like we are very skilled as like NICU parents with protecting our babies from these things, right? Like we already have the hand washing down, we already have the like masking up, we already know how to make sure that these kids are very protected. And so I feel like it was kind of just like taking those skills and then also then putting it on to like on a higher level or higher scale. But I think because again, we didn't know the extent of the pandemic, we didn't know the extent of the level of the lockdown, there wasn't very much information at the time. More of it was just like what they have always told people who have micro preemies, right? You don't take your kids out for a while. You protect them as much at all costs. You don't let them talk, don't let people hold them. You stay inside. And so that kind of just got extended to a higher degree because of COVID. But yeah, to be honest, it was very much just like an extension of what we already know as NICU parents.
Absolutely. And in the beginning of the pandemic, I talked to a lot of parents who were discharged years before, even myself. My son is 8 years old now. And we got discharged right in the beginning of RSV and flu season. And I totally isolated myself and our house. Nobody would go out besides to doctor's appointments. We were kind of prepared a little bit to face this isolation period or lockdown or hand washing, because a lot of us NICU parents had experienced that before. But I think it's right now, because the pandemic is so new, right? The virus is so new. There was not a lot of information right in the beginning. So I think there was an extra level of stress for parents. So my question to you is, how about taking her out to go to appointments, because you had follow-up appointments in hospitals and clinics? Were you emotionally prepared for that? Because one thing is for us to, okay, I can hand wash, I'm going to mask, and I'm going to, you know, have the logistic. But how did you feel emotionally taking this baby to those appointments? Because a lot of parents are asking those questions right now. Is it safe? And how did you feel about it?
I would say to parents in that situation to trust your gut, right? Like if you don't feel comfortable taking them into an appointment in a hospital, especially like, you know, hospitals are where people are getting tested, a lot of people are sick, don't do it. And I don't say that lightly. I think that it's really hard. I took her to appointments at various hospitals. I went to Sick Kids. I also, for her ROP, her eye appointments. I also went to Michael Garron twice, which both of those places, Sick Kids had lots of like, the whole thing was shut down when I went. And then Michael Garron is actually one of the testing centers for COVID, and I took her twice for her cardiology appointment. I only did that because I felt like I could, and I was safe enough. And I feel like if parents don't feel like they can keep their kids safe and also like do the precautions that are necessary, which is make sure that they have their mask on, stay away from everybody else. If they don't feel like the hospital is taking the precautions they need in order to make sure that they only have you in the waiting room, for example, by yourself, I called ahead and I actually asked both Sick Kids and Michael Garron to make sure that I was the only one in the waiting room and that I was the only one that was going to be in that space for that time. Because I told them I have a micro preemie and I'm not risking it if I'm going to bring her for this appointment. But at the same time, she needed to get this appointment, right? If she had ROP any higher level stage than she did, she would have needed further assistance with that. And I didn't want to risk not doing that for her.
Absolutely. This is a very important message for families, that we always check with the healthcare professionals not to skip appointments, because some appointments are extremely important for kids.
Exactly.
Or appointments for RSV injections. Some appointments cannot be done online, and very important for families to go to those appointments. And you did a great thing at calling, making sure to reassure you that you're safe bringing your child to the hospital. I think that is very important for families to be reassured that it's safe to go, and how to go, and which protocols are in place, because there's a lot of protocols.
And to be honest, the hospitals are doing a really great job. They know how to manage these kinds of things. And because we also understand a lot more now than we did before, like this, mind you, like I was taking her to appointments in the hospital at the very beginning of the pandemic when we had no idea what was happening, right? So we didn't know about social distancing in the same way. We didn't understand the levels of social distancing. And so it was absolutely terrifying. I totally get that it is very scary. But as I said earlier, like the appointments that I said no to were ones that were okay to have over the phone, right? Like there were appointments that were, you know, just checking in about numbers or how she's doing, but it wasn't appointments like I need her to check her eyes or she needs to have an echocardiogram, right? Those are things that I can't do over the phone. And they were very particular appointments that I knew I had to do my own research and figure out how to do it in a safe way for both of us. And it was fine. You know, like I went to, again, 3 different hospitals. I also actually took her to Humber River multiple times for her nutritionist appointments. And, you know, that's going back again to a hospital setting again. I've also taken her to her pediatrician many times. I always just make sure that I feel comfortable with the protocols that are in place. And then I ask them to do things that make me feel more comfortable.
Absolutely.
And they're very happy to do that. I think that if you're able to advocate for yourself with medical professionals, they understand the terror that we're feeling and they want to support us in that. So I would say that like for parents that are listening or watching or parents that are in the NICU and are scared about these appointments, it's just about asking for what you need and also making sure that you have what you need to feel safe. Like I always make sure that before I left my car, I always made sure I had everything like lined up, like my hand sanitizer, my water bottle, like whatever else I needed to feel like I didn't have to reach for stuff. I didn't have to like put things on the ground, like things like that, so
Absolutely.
have what you need, be organized as much as possible, and also talk to your healthcare providers around what are some ways that you can get the information or be in the sessions you need to, and what are must visits, and then what are maybe we can do something different.
Absolutely. And tomorrow, actually talking to the Sunnybrook team about virtual neonatal follow-up appointments. Aruna, 7 months later, how is life for you now at home with a baby?
It's great. I mean, I was actually just talking to friends recently about this. I feel like having, and I'm sure many NICU parents can attest to this, is that it is, every day feels like a day of like a lot of gratitude, because I mean, I don't know what it's like to have a full-term baby, but I feel like we don't take these moments for granted. Every day when she wakes up and she breathes, I'm like, wow, you did it. We made it. She's sitting up now. She's eating solids. She's babbling. She's doing lots of fun things that, looking back at this time last year, I didn't even actually think that she was going to be alive. Right. So I think that for me, living in that gratitude for me is very important for me to keep going. Living in COVID is really hard because I think a lot of what I thought was going to happen as a parent of a single, as an autonomous parent, and being able to access a lot of my friends and family that I can't is really, really difficult. And there's a lot of grief, of course, around not being able to do the things that I would have hoped. So, her first birthday is coming up. It's probably going to be on Zoom. That is not ideal for me. Like I would have loved to have had an opportunity to celebrate her and her life in a big way, and in person, but I unfortunately can't do that. So There's a lot of grief, I think, that is coming up around being in a lockdown during this time of her first year. And also, just the fact that, we haven't been able to, I wasn't able to do like the early years programs or like these other things that we could have been doing to also support her in her development, which feels even more important as a micro preemie. So, but we're doing it. We're making do, and getting support as we need. And actually the follow-up clinic at Sunnybrook is amazing and providing a lot of those support. So, yeah.
Absolutely. And also for all the families listening to us today, we do have a peer support group on Facebook, the Canadian Premature Parent Support Network, where we change a lot of information. We do the celebrations and we talk about grief and other hard topics to discuss in public, but inside a safe environment where other parents of preemie babies can actually relate. And we also have the COVID care program that families who are in an NICU or a year post-discharge can access. We have 2 online therapy sessions available for families for free. I think those are important resources for families to know, and especially at this time when you cannot have a social interaction or celebrate those beautiful moments that you mentioned. And, we have to address the feelings that surface because of that.
Yeah.
Aruna, one last message for healthcare professionals who are watching us here today. What would you like them to know about being an NICU parent?
I would love to say thank you, actually. I think that as a parent who went through what I went through, a lot of the times where I had felt a lot of solace and a lot of relief from like the heaviness that I was experiencing was because of these strangers who became my family. And, I'm still in touch with some of the nurses at Sunnybrook still, and they still check in about Surya. And it's because like their deep, deep commitment to these babies. The neonatologists at Sunnybrook also, you know, some of that, like, I literally will always say this to people, like, they saved her life, you know, and I would not have a kid right now, like, to like love if it wasn't for these people. And so I want to say thank you, first of all, to them, because I think that their commitment to our families and creating our families and supporting our families goes without saying. I would also like to think, I think that a lot of times, from what I've heard from other families too, I mean, I didn't really experience this too much, but from what I've also heard from other families is that sometimes there's a lack of patience, especially when things are so high intensity. And I can't even imagine right now with the intensity for medical professionals with COVID. But patience for parents, I think, is really important. And patience for not maybe understanding or maybe getting upset, or maybe not wanting to hear, you know, the truth that are happening around their kids' conditions or things like that. There's a lot of things that I think are there. And then also for myself, I think it's really important as like a queer person of color, to also say, and also someone who is who has a different kind of family structure, is that to not assume around people's pronouns, gender, sexuality, or what their family looks like. I had a lot of moments, as much as they were amazing people, a lot of folks I had to consistently tell that, you know, Surya doesn't have a father, you know, so she's not in a regular or quote unquote regular nuclear heteronormative family structure. And so I think that, you know, making those assumptions can be kind of harmful to folks if you're not asking up front what their family structure looks like and how they want to identify. That's really important to people, especially in these awful, crucial, hard moments where things are already hard as it is, let alone you having to explain that, you know, you're a single parent or an autonomous parent, or that you're a queer couple or whatever the case is. So, but yeah, all that to say, like, I think that we're all in this together and we're all going through it. So supporting each other through that and understanding, I think, is the main key goal here.
Aruna, thank you so much for sharing your experience.
Thank you for having me.
Your journey so openly with our audience. I'm very grateful to you, and I wish you and your daughter all the best of health. And I hope I see you soon again on CPBF channels. Thank you.
Thank you for your work. Take care.
And thank all of you for joining us here today. And I want to thank AbbVie and Pampers for the ongoing support to the Preemie Health Talks. And CPBF is a registered charity, and 100% of all donations received during this week will go to our educational programs for families. To donate, please go to CanadianPremature.org. It takes only 3 minutes of your time, but will make a huge difference in the lives of the families that we